We're late, but we're going to start in a few minutes. For all of you listening from outside of Palau on Facebook, we apologize for the delay due to other technical problems. They were paving the road. That's what they're doing, and it takes about a half an hour from Gurmit to National Hospital. Anyway, stand by. We're going to start our program in just a minute. Okay, madalo siya sola malungin ko sige mergido rogoy sola tial mo rin sa superstation of WWFM at the 8AA joint broadcast at the program real ko sige malungin ko sige legor ko mi rogoy ito ayamar mora rogol audience selwa say ngania traffic congestion malugam ngania problem na traffic in one lane in mora immune sa moromla le one lane sel mera intersection moromit ang mal heavy traffic real time mangel facilitator gidam Dr. Ibn Meo announced earlier was a more delayed like 20 minutes after 7 o'clock. It's not too late. We can cover the whole issues, those issues that we're going to be discussing this evening. Okay, our audience are all over the world, and my name is Alfonso Diaz, and also I don't know who's facilitator Marubin Gelbugo Uherbelau. Anyway, Palwin was singing Megitro. Okay, Mother was say like the Matringi, so I made one Michael Sangel facilitator Gidel and Mr. Uherbelau, Gaafar Uherbelau, but one Mike Bolomura program leader I was saying, Gaafar.
So I say Malungil Gopsingi, Mr. Diaz, to Liga Malayamara till Novio to start the program. Magklolo rio ang aringi matangat talembuk maungi la rolet hindi sige the traffic hindi I think it's a good sign tulig it's a good sign was everything's slowly getting back to a normal mar ada ko amla mo tribil pagklolo ngi del buk tobe de omai se ongur di again ngada di maklat ka beklad lo se kada di gergikla get preventive measures. Of course, mlania klol graduation lalsil sa mga direct al mugtiat al congratulate the whole graduates sa 2020.
Okay.
Ngat tulig ilang kumdas we're among the handful padaman makasayal balura blul adal plus ngalged tirgel mo tuwa dal book sabi physically participate graduation so ngat tirgel say.
Okay.
Maring asule metulik mati ATA ra tel joint broadcast as always kadangat teleng atyang tigat urtoktang kada koram lo masadra maintaining our wellness in general the members and last tel ukwana talk show gidra couple of weeks ago interior toktang mar adra lab ma adra surveillance ma direct nurse kada koram le promise el waser mo mstret alla Dr. Osarch ma Dr. Fraser mo tukuk mail whole talk show typically tamsadra kuk tirgel elderly ma vulnerable population ma tirgel korangan ya underlying conditions sa marakti mo tangat terung Dr. Osarch ma Dr. Fraser mak welcome til mera panel sisil time mga tiang incident commander gidel reader udoy PIO Lodon Microdeo liaison director share madraisaw madirekal hindi sugiyaman yang apply section mang di more say gide etulig bike wa te alam sa Dr. Osarch malbol lomura talk show gidel
okay.
Welcome singi Senator Diaz, Tulik.
Okay, welcome singi.
Dr. Osarch, tidak kalau well known, aku tunggu award lak hospital kamar nom sa regel donation kau.
Okay.
We put them into good use.
All right.
Kapral masaula. Kada belua badengelo singa kamera lo Mr. Tirgel special population el tira elderly tim iwa urabla el diaglo mai tirgel ya smerel bu Mr. Tir endin seberlo Mr. Masisi dik mal malamol malol dub alwasi odir gam sisi molomol malmrai lem exercise ngungi rabatangir tungkura toira covid senator dia se nga ka malmaral malidura uluk dial tapi keling tungur trigal elderly akum autoswega wase they are for some reason akum naswa say they are at low risk and they are at high risk yak mosma dagel tablo awul makaset low risk tirel el dikira bla el dia halbor
dia kal sagabais
dia halo ngosu le dia kal sabi lo mais et di ngara apply mangegare exposure mortir ya ud makaset tirel high risk tirgal adlo betatrir marangar ngara apply mar visitors dirigegi dia mongu tiarak tengul mirabla me masangal mamang mabapa mang aul makaseta low risk kelem dia ha mal gegare or no exposure er on uluku dia ha mamrut artir ma dia ha ola barak tani maul makdol gerati lo seta high risk vulnerable population trial special population el gire dal pay attention and mortir
I see.
In terms of vulnerability, tamaral giril special population, lende hal ngarang tam uod la already el bato ka medical problems artir, mang low immune system artir, mang ate liral mo mera ma mal klo ma aul marmal masaw daringi dia harul tiang ngarinya sesel garal lalu ai selo asial tango rioran dia kan dindir ngaringi omsub enti a hotel klol gurul tiang senator dia sada prevent teringi mga madawra rogo il families et mo malas mal subi jarak tel mo understand teringi accept teringi dia kan sesel garanti daigal tokoil gim rurtar adol hospital meru le malgoy ekmal mongil understand der rak teleng maring rakta take it seriously yakpal mga madawar tiren mo o family and friends mo adu radolong liren siblings luase mami mabapangarablay wat kita wiskertir ta nga mo ovang tangara nga mo support how do we help each other ka kota loba mami mabapa o masubo lo ase malsu mangmornya mosmer engirel roid dia kalpera bitara ngal odla mo kay ngeseura ora lakal ma ora la ilu malma atko era siungela mami mabapa engia mo beot el suku mengarnya maul mak kwase malungi la family and friends al su mengarnya mosmer engel agal ngul isolated ngi dia kapolke el suku makasmer mo akmal mga madar kami mer hospital med check mang dia kakarul the number one medicine for this prevention, understanding it, mo madangali rogis, ekmal mo understand, accepteringi, mo mga tmok ragi del girel. Makti mo ri say givya, el mutro rin asulem, el nga niya question ak answer, Dr. Adalbaya Mosma, dahil kukura, retail ra arakta.
Tell الآن كذا كذا هذا ضروري they'll try to educate ourselves and the families and the members of the community. بنقول لهم هسه بقولوا أكلم دنيا رجيد را الواسطة المغرات prevent رجيد من يعبد السير تيام مسل ما يقدمنا we fully aware of how to face the situation. من تل ضروري الآن غورا ويا سيقدم ساعة غورا prevention we'll make sure that prevent ourselves from getting COVID-19. What you say?
Why say lel suku bangkawangan kal ngarabla edi mga su ekmal klote le melmu jarak tanul sa mami mapaparabla tira lo mais mang ay obol ko ya mal maral to ko I hope it mo understand us.
Ela ko kosngi ngapten na mo hamne almost 3 months self malik ngarabla dia porgel because my age hindi mo nakasal expose myself hindi naka-aware gid el-tester gid hindi sila may kaya testing magdam lo tester gid emergo mo madangel wasit tirgel aset quick responders maluban tirgel tirang airport tirgel frontline for responders المرور تيالو ريور سرال تست تير لاك سولار هذا قران مكلار ندير المسب المرال مراستوان ما نقول لهم قران شيء سخمرال المرا مغيم درا تيالي اي سولار مثلا كبلا هاي سكول من ادارت مدرني تيغان مو graduate الديم لاكا يمورتير لو ماسك ما ديم لاكا لو ماسك ما ديم لاكا لو gloves ما ديم لاكا بل انقام نقول لهم قول واسكا تنغرا بلو كتغاي ورينس تقوي رينس رميول experts مرقوم تياجي دم لامو غار ادل بوي دال بورغي تيارك تيجي دا مالدير كملمول من COVID-19 free من اودورين سايد تقوي مولغوي مرغوي يولون سينس مرغوي تياخا بودو كورام تيتو امداد الواشن تيجي على مي بودو بترغاك لن تياخا باي تولمول من prevent ourselves مدياخا بودو سير سيدا سوميا كيبا مودنغلير اترابلو واي سي
Yes. Kamal maral di lungay gel ngaraw dasue kamal masaul.
Okay, thank you. Okay, katulmon mo Gaafar.
Mal masulang Dr. Osarch tuloy way gel mo ko katokora klorungud ungilangud ndi at the same time ngira dal mal timalat kara acquired acquired pa ngiya ngara apply.
I see.
Malas mal di practice de gay do sadra bikilsil sa kana mo korik المالبال إيماد سوما كده اسماء لا كده مايس كده غروي درجيتر هذا اسماء even though دلقا هذا المدان ارتيال راق ترى بالواد النقطات تتمرود عندي كده تيجريك ل دي ملات كرا تيجي كده المواد تيجر مود التير من لاق البنيا التيال التيرا مسمير
واسي عندي همي كفارت بودا تتاخر روكو كده نغتي الشور على بسنه دورين اسولير ادر اول بي رخلو لاو ما نويل رموغر سراك رينسل ملواسي ang temo askoki mes aswebel merbelao obtetria rangal merbelao ngara stakara guama elsewhere merbelao solanga malngalom ra leadership tam mal otngi a presidenta senate ma direct speaker house of delegates ma total leadership nos in modong ok pemergo totally reject raudasura se tot sispra tapai ki lengera ase Sip edel tobe de tiram borrei tirgem nestar belau ndin dia ga mesois bel ngara outsider belau mesois no klar mud mel mol lungi lar mud sebok bio dia kora horil wase ngar ngarak tel belu kutoram lam of feel free mal de menga suler adro bi rakhlu law no sabil convince tirgel adro tiram nesoril lo chispra malaran lege ngara outsider me pai me domestria udod mol mol ngara gel ngar ngi ngil besrir emerko kita tolas mengara prevention side of it eto ngi mo until when selbonia vaccine emergo to protect ourselves selber the vaccine mal medication el mo pot ser en sebedro hospital el twitra arbe birkit mentor ngasuri atrol birak lula me bodo da kator ngasuri atrol birak lula motor leadership el bela sensible way say
ya kamal sulang etulig et ungay sero kulto el doru la maldi tuira a leadership makaidan sa leadership gidra Uherbelau
I see
dia kalbet toko tulig dia kalbet toko sel do ngelo senganian ngelged ngara outside la am lamqaw de digat sabil may ma
I see
al adul qoram tabsta dalang clear outside ending maral ngira dal mal mongilom das lo se al sugum ngadam ngatbok laway gay gidlo al malasam lok tetril may ngara benefits sa mga nangay risk mo.
I see.
May arungod lang hindi ka dawa baby rablu ko radio re del soy sa brato ko. Leadership ako mdas mal ngila approach ngin mortia ng gida del mesaro ko angle sa may gerogul possibility am rokotal المليبل والسغل ممقرام ما يستندي أكيد dia bangge metuli ke bringa sulia adro olbil of course obviously president ma ini sira akaidan sulti
alright
kuktunga te ale tuligin sanga Dr. Otherwise Fraser malukul di lukura di mo maklat kirgi dra igel general marake lakura tips ma recommendations ra kukto era prevention NCD mati direct sa el kukura olga ser tirgel adro already ngani asadis kasi makaranga di dolmol al healthy malasam al prevented tagi del Dr. Otherwise Fraser.
Okay.
Ali. Thank you for having us again. Okay, so greetings to all the listeners. My name is Dr. Myra Fraser. I work at Bilao National Hospital in the Department of Internal Medicine, and I also work as a NCD physician.
Okay.
And this is an extremely important topic, and I will be talking about NCD in Palau. I will also be covering a little bit about NCD and COVID, and also I'd like to share some tips to everybody who's listening.
Okay.
So just a brief overview. NCDs, that means non-communicable diseases, and are chronic diseases that are not transmitted from one person to another. And they are usually classified into the following. So number one, you have your cardiovascular diseases, and these actually are, under cardiovascular disease, you have hypertension, stroke, heart attack. Okay, and then number two, you have your diabetes, which is a condition where you have elevated blood sugar. So this is when you're saying, you hear like, and this is usually diagnosed by blood testing, and a provider will let you know, and a provider will give you certain medications such as tablets or even insulin or orus. Number three, we have diseases of the lungs, which are known as chronic respiratory diseases. So under this, you have asthma or ngul. You have chronic obstructive pulmonary disease. This is a chronic disease that can develop if you smoke or if you've had an old infection, old pneumonia or TB, and it weakens your lungs. Okay, and then number four, we also have cancer. So those are the main NCDs classification that we have. Risk factors for NCDs, I usually like to discuss them divided into three. So number one, we have behavior risk factors. So these are actually things that we can prevent and that we can do so that we don't get NCDs. And they include tobacco avoidance, alcohol, like avoiding alcohol consumption, unhealthy eating habits. So basically, I'd like to emphasize that this means we should be able, and we should try to make healthier choices to avoid getting sick. Number two, we call these metabolic risk factors. And this is when you have an elevated blood pressure or a high blood pressure, if you are overweight, if you have high blood sugar, or if you have high levels of fat in the blood. And this is really interesting because these can also be exacerbated by unhealthy behaviors, as mentioned before, like smoking, too much salty foods, eat fatty foods, and not exercising enough. And then the third risk factor, these are actually, all of them together play a role, would include your social economic factors. And these are when you talk about financial challenges, poverty, environmental factors. And these end up leading to challenges in getting access to healthy food, getting access to safe place to exercise, and also an access to health care. So basically, it's multifactorial. So just to summarize again, the risk factors include your behaviors, unhealthy behaviors such as tobacco usage, alcohol consumption. For example, metabolic risk factors, which include your elevated blood sugar and being overweight, and having high sugars. And then you also have other environmental factors, like maybe not having enough space to exercise. So that can be a challenge. Okay, so being said that, I think another really important thing we can share tonight is just going over some of the local statistics on how much has these NCDs and these risk behavior has affected our population. And I do want to share some numbers that was obtained from a survey, a health survey that was done in 2016, which is called the Hybrid Survey. And they conducted, a survey was conducted on 1,768 participants here in Palau, and then we found that 72.5% of the people surveyed had obesity, and they were also overweight. Diabetes was found among 22.2%. Hypertension, 32.9%. And interestingly, measured elevated cholesterol was 4.9%. So if you look at it, the ones that are quite high that we see is the numbers or the prevalence of obesity and overweight here in Palau. And this is really important because when you generally get sick, for example, with COVID, sometimes other comorbidities or other conditions like being overweight, diabetes, and hypertension can really cause you to have more complications or really severe illness that you could actually die from. So this is just something that we like to really emphasize again, like part of our care is controlling your risk factors, which was mentioned previously, your behavioral risk factors particularly. Okay, and then again, like I have, based on the survey, it shows that for the tobacco usage, cigarette smoking is, the prevalence of cigarette smoking is 20.4%, and smokeless tobacco use, like chewing betel nut with tobacco or the what do you call those? Red men? Yeah, like the red men. Yeah, the smokeless. Yeah, I've seen them around, and they're quite expensive. So, you know, this is a very interesting thing because the number of people based on the survey that uses smokeless tobacco is quite high. It's 45.8%. And tobacco use has a direct association with increasing risk of infection because it has to do with putting things near your mouth. So I hope this is something that we need to really encourage. I really, really encourage all patients and everybody, when possible, we need to really think about stopping smoking and even being careful with our hygiene when it comes to chewing betel nut. Okay, number 3 for alcohol use. Number of persons on this found to have used alcohol in the last 30 days was about 41.1%, and binge drinking is 27.3%. And we know that alcohol is linked to many damages to your body, and I really do want to emphasize that we see a lot of liver cirrhosis or sick livers because chronic alcohol use. And this is really, really difficult because if you have complications such as severe infection, you may already have higher risk of bleeding complications because the liver is too sick to produce enough platelets in your body. And lastly, the fourth risk factor that I'd like to just mention based on the survey is we're not getting enough serving of our fruits and vegetables. We need to have 5 servings of fruits and vegetables, and the survey says that we're only getting, about 90% of our population is not getting enough nutrition. And we really need adequate nutrition because it helps build our immune responses so that we can fight not only this COVID, but this other infections that we may get. So, okay, so that's just one something I wanted to share based on our hybrid surveys. That to summarize, we have majority of our population suffering from overweight and obesity. We have a very high prevalence of or percentage of smokeless tobacco use, which is also a potential risk for getting infections. And we're not getting enough nutrition. So I'm hoping that, in the days to come, this is just something that we can all think about when we go home. Think about talking to each other, friends and family. Let us try and cut down tobacco usage in the household. Let us really try to choose healthier food options and encourage each other to do so. Okay, so moving on to the next thing that I wanted to share today was just a little briefing about the importance of controlling your NCDs in terms of COVID-19. So what we know is that COVID-19 primarily affects your lungs. So patients with weaker lungs, such as those with uncontrolled asthma or uncontrolled COPD, if you do get COVID infections, you may have a risk of having more complications such as lung failure or really severe pneumonia that you might not be able to breathe well. And this also affects your oxygen exchange. And this is how you hear people end up on mechanical ventilator or like a machine to help you breathe. And this will be a really challenging thing to manage. So as possible, we really want to encourage all our asthmatics, continue taking your medications as prescribed, and mainly these are inhalers. Please reduce chewing, because chewing can also cause a lot of dental issues that can lead to recurrent infections. That actually, because the mouth is really, really close to, if you have recurrent infections in the mouth, you have more risk of having pneumonia. And it can also make you, chewing can cause you to cough a lot too. So that can also trigger a little bit of some breathing issues. Okay, number 2, diabetes, sugal. Poorly controlled diabetes is linked to really severe infection, and this is really because you have a very weak immune system secondary to uncontrolled diabetes. So how do we control our diabetes? The best way really is taking your medications as prescribed by your doctor and openly communicating with your doctor, because if comfortable with what you have, we can always try to find the right medication that works best with you. Number 2, eating right. Eating healthier foods significantly can help with your sugar control as well as exercising. And then number 3, I always tell my patients, lastly, yes, try not to stress. Stress can actually cause your sugar to go a little bit high. Okay, now the next point that I wanted to mention is based on the recent trends, it has been reported that COVID-19 infection has a higher, has an association with strokes. And this is because it causes some damage in the vessels and they cause blood clots. So I think for this, it's just as much as possible, if you may have stroke-like symptoms or you have any concerns, any dizziness, please come in, and then we can also help screen for other risks if you have risk of having COVID, or we need to screen you for that, or if it's because of high blood, malabing sukal. Okay. So those are just some of the associations that I wanted to mention. And again, I really feel like it's quite important to emphasize on the tobacco. It's been published in many papers that tobacco is not only harmful for the body system, but it really does have a lot of changes in your lungs. And a lot of the trend with the COVID-19 infection is it really causes a lot of respiratory symptoms. So, like mentioned, we don't want, you really don't want to put yourself in situations where you're at risk for having a weak lung. So we really think about reducing your tobacco usage, quitting. And for those who are using the smokeless tobacco or chewing, please consider cutting down, and also please consider, maybe hygienic measures. Clean your betel nut. Wash your hands regularly. Don't share olbal. Don't spit on the ground. Palau is so beautiful. Please don't spit on the grounds or on the buildings, because I do see them around. That's pretty much for the tobacco. I know that there may be many challenges with maybe not family and friends here, but family and friends abroad who are going through quarantine. And I understand because I have a sister who lives in the U.S., and luckily she doesn't have any NCDs. But I'm just thinking about a situation where you may be at home and you don't have a lot of connection with your family and your friends. You can also have risk of depression and mental disorder. This can also complicate NCDs. Like when you're stressed, it can cause your sugar to go high. It can cause your blood pressure to fluctuate. So always reach out and support each other. And call for help. Always look for professionals if you really feel under the weather, because you may be in need of counseling or even some treatment. So please reach out if you really need to. Okay, and I think for the public general advice, it's just re-emphasizing washing your hands with soap and water frequently, alcohol and hand sanitizers when possible. Secure long-term medications. This is for your chronic medications, like your diabetes meds, your hypertension. Please refill to make sure that you have enough. And you should also refill before you actually run out so that you don't miss one day. Continue to eat healthy as recommended. Low salt, low fat, balanced diet. And you can even do home exercises if you feel like continuing those social distancing. And for the younger persons, I really wanted to re-emphasize what Dr. Osarch mentioned. Please think about the risk when you're out, not just for COVID, but I'm thinking generally other infections, other respiratory diseases. You may be a carrier, or you may have symptoms, and you go home and see mom and pa. They're relatively more weaker, so they can get more infection, higher risk of infection. So that's just one thing. Practice sneeze and cough etiquette, and avoid touching your face and your hands. And please cut down tobacco usage, when possible. Yeah, that's my favorite. Okay, I think that's about it.
Ano lang Dr. Adalbay Fraser, hindi ako nagkira tulik.
You have time? I got questions up to the sky. Really, I have a lot of questions, but let's just talk. I strongly believe that your inheritance, like if your parents were diabetic, that means to me it's that disease is in your body, and if you don't take care of yourself, then you're more activated or wake up that whatever it is in your body that creates high blood pressure or create high cholesterol. Because like my mom, let's say, had a high blood, they said, yes, you're going to be a high blood. Until today, I'm 70 years old and I'm not. And it's, yes, you're going to be a diabetic because somebody in your family is diabetic. And I said, well, until today, I'm not. And I think nobody knows each and every one's body but yourself. I strongly believe that, if I had something like sweet yesterday, I'm not going to touch no sweet for the next 2-3 days. I kind of balance and eat a lot of vegetables, because there's, every food provides different nutrition, which is your body needs. So if you don't, you only eat like onral, otoim, what about the other stuff that your body needs? You know what I'm saying? And you know what? I hate to say this, but I'm being honest. I'm a straightforward person. You know, when you go and teach NCD, check your staff. Check the people that are part of NCD program. Most of them are obese. Most of you guys are obese. I mean, you're very, it doesn't match what you're saying, because you said don't eat this, don't eat that, and don't chew this, don't chew that. And after I look at them, they're doing it. So it comes to like, do as I say, not as I do. You see what I'm saying? So we're confused. Confused, let's say. If I follow each and everything that you told me, can you guarantee me that I can live to 95 years old? Because I know some people are young and die because, like, for example, could inherit from our parents. No matter what you do, you're going to die at that younger age, before your time, because that disease is in you, born with it. Maybe I'm wrong, that's how I feel. Giredel bay wase asugum bagiri was asugum angarnya a family kawa angarnya diabetic ra sel maluba the mamang drama diabetic. More likely, if you don't watch yourself, you know, the kwadim terkak labren room by ekamos me erngil ngal arbang arabangem. Why sendia? Why mobom terkak labangem embergoe. Ngwa omokerngin kal biking among mostatel create tiger rogul dia halngia so amang arabangem. Mangania other tergel dola say. Nganga hepatitis B, adamal madalalom le hepatitis B, so they're gonna die from that disease. And more likely they're going to die from that disease because they inherit inheritance I get the disease from our parents. Since say
hepatitis B are they'll inherit, but it's I think the term I would use is transmitted. It's a transmittable disease. So you know, usually if mom and dad has hepatitis, for example, and all the kids had hepatitis growing up, or they were tested at a young age, then you might say they could have inherited or transmitted from mom to child.
Oh, I see.
And you know, if you do have lifelong hepatitis B, some of the care required for that really is changing lifestyle, diet.
I see.
Really avoid alcohol because that stresses out the liver.
I see.
And avoid fatty foods because and other lifestyle that can lead to fatty liver disease, and that really complicates everything. Yeah. There's treatments like I think it's good to address this because I recognize this is the month of May is the liver month, liver awareness month. And you know, we can prevent hepatitis B. We can prevent it by vaccines, and we can prevent the complication of liver cirrhosis or sick liver or liver cancer by following up hepatitis B and giving the right treatment.
I see.
Yeah. So thank you for that.
And you can there's a they give them a shot.
Vaccine. So we've been quite lucky with you know, availability of having vaccination against hepatitis B.
Yeah, but before there's so many % of us Palawans that are positive.
I've been seeing the trend because majority of I don't have the exact numbers, but I do see in the clinic lots of circumstances where I have patients that we newly diagnosed with liver cancer. And then retrospectively screening them, they have positive hepatitis B and they're a carrier. Yeah, so because we know the virus itself causes a lot of inflammation, and then with that you can have you know, stress and replication, so it grows tumors in the liver. So that's how you get the cancer.
Yeah, so more likely if you're positive or a carrier, you stay away from alcohol, right?
That's very, very true. Very highly recommended.
Yeah, and for some reason, there's so many % of the total populations that are carrier, and and if you didn't get a shot or a vaccine to prevent you of getting that, once you have it, it stays with you until you die. Is that true?
If you are a carrier, it stays with you. You may not have symptoms, and carriers, they can be in a stable state, or they can be in a reactivation state. And when I say reactivation, that means the hepatitis B, and it's no longer sleeping in. It's actually active and it replicates. And there are tests that we can do to determine that, so that we can make the referral for treatment.
I see. So, and it is a highly contagious, right?
Yes, pretty much so, yes.
Right. So, in other words, if you have hepatitis B, don't share toothbrush or let your partners know that you're a carrier, so at least they can prevent themselves from getting it.
Yes, and also come in to see us so that we can put you on the right treatment to suppress the virus from replicating. Because once you control it, then you won't be so much of a danger to a lot of people. It's best to just suppress the viral replication treatment. Okay,
so in other words, NCD program here in Palau is working, and a lot of people are following it. I agree with you. A lot of things that you said tonight, and I think Palauans are more educated in terms of prevention of what to eat, what not to eat, how to take care of yourself. There's a lot of people down at the track and field, running and exercise every day. And I strongly believe that, if you exercise every day, your body will be strong enough to, reject or push any disease coming into your system, because your, immune system works good. But if you have other health issues and you don't take care of yourself and take me till eat type of a life that will expedite the end of your life, or you're going to go before your time. So what you're saying now is don't eat like, for example, food in the canned food they taste good and they're very easy to prepare, right? But what we don't know, us Palauans, what we don't know, there's a preservative and additives that makes, and the company that makes this stuff, they make you hey man, it tastes good, so let's go for it. Especially corned beef, right? Corned beef is really bad for you, and I've seen people just open the can and eat it, and it's not good for you. But when you tell them, and they turn around and say, it's not right. Don't eat food in the food in the can is temporary. You came from work, kids are hungry, once in every blue moon, do that. But every other night or every night is not good for your children and your entire family. And NCD, right, NCD?
No, thank you for bringing that up, because I think we really need to emphasize healthier food choices. And I like how you brought it up about, I know that some of us are quite busy, so we tend to cook canned food. And to be honest, I understand, because sometimes you really don't have anything available.
Right.
So, as long as, I really don't say go ahead and eat it, but as much as possible, avoid it. Look for fresh, local foods, fish, Uherbelau, yasai. I mean, the way that my grandma from Maralong lived to a very elderly age, and she didn't have any significant NCDs because she worked at the farm every day. She ate local food, and she died a very natural death. And that's something that we really need to revive and see.
Yeah.
Speaking about that, if I may share, it's really, as a young physician, it's really, really heartbreaking to see, especially a lot of our NCD patients obtaining complications like stroke, because I see how it affects the whole household. It affects, you have to mobilize people to take care of a stroke patient. Some people may have to leave work to take care of a stroke patient, and it has a lot of significance in a household. And when you have such challenges, it leads to more risk of having NCDs. You may be so busy looking after somebody admitted for stroke that you just go to the store here, Manterang, and buy
Right.
a can of corned beef, mabras. Yeah, and and it's really hard because it's a vicious cycle. So as much as possible, malvia that prevent. And I really emphasize prevention of complications because we're in a sense, you may say we're sort of like a limited resource setting. So we may not have tertiary level care. We don't have access to the catheter lab where you can do an angiogram and a bypass of the heart. So that's why we say let's do follow-ups regularly, really take control of the diet and take medication so that we prevent having to refer to higher level care.
Right.
There's so many burdens that comes with these NCDs.
Right. And experience this one thing. I used to, like, when I fry something, I take the oil and dump it into the sink. After a while, the water doesn't go out, and I say, what's going on? So I took the pipe, 2-inch pipe, under the sink. I took it out and I looked at it. It's plugged all the way. And when I shake it and then push it out,
oh my gosh.
Mantega. Yeah, it's mantega. After so many months, years, that we just dump it in there. And that's what, and I said, oh, this is how you get a stroke.
Yes,
when you consume that meat, that comes into your system with the cholesterol, there's 2 different kind of cholesterol, and it's the bad one I'm talking about.
Yes, absolutely.
And just imagine those veins and arteries that, as small as your hair, right? Running all over your heart up to your brain. Those cholesterol gonna run into those small veins, and when they're thick like that, they're not gonna go through, and then you're gonna have a stroke, right? And a lot of people, when we tell them that, or the government, or you guys tell us that, we don't believe that. Letial manteca ngarela ngamo sois bertial mal gegrel ngur tertial telu medi emuldel de mantia kaltu mangogmara kamamat kamlo. You see what I'm saying?
Yeah.
I totally agree with you that we need to talk more about this and educate the general public that eating, like I have a gout right now because I love to eat magabut and room, Yeah. So I start, my right foot, start getting, and I said, whoops, I'm coming down with it. So I said, well, I'm going to have to get my medication, and then wait. So 2-3 days, it start going away. But I knew that I'm going to get it. But sometimes you just cannot hold on to yourself when it's just something like that you were born and raised with it, And somebody put it in front of you, put it in your mouth before you think about it. But anyway.
One thing I'd also like to mention, because I know you mentioned previously about mom and pop having diabetes and this being inherited. So I just wanted to confirm that there's a small, based on studies, they actually say that family risk, like if your family member has the diabetes,
it runs in the family.
Yeah. It's actually the study shows that your risk for getting diabetes, if your family has diabetes, is only 40%. So 60% is more of your lifestyle.
That's right.
Yeah, so that's something absolutely I feel like we can prevent 100% because I've seen families where mom and dad have diabetes and hypertension, but then the kids are doing learning lessons. We learn from our parents. We learn not to eat these unhealthy foods. We know better that alcohol and tobacco so we learn to avoid these things. And if it's a habit that you really get used to. And I think being healthy, it's one of the best feelings. Feeling healthy, having enough energy to do your task and take care of your family.
Right. We can sit here and talk about NCD all night long, but
I know.
You gotta give the microphone to Gaafar. Gaafar probably say, "Hey, time out." This is our show, not your show. Yeah. Okay, Gaafar.
Sulang tulig ako na singadi otil the importance ng gila ang ngani pandemic man la.
Ay.
Gila dali mo problem ngit.
What say?
Especially sa Dubai gay gidil. para klol rak tel sabihin merabalwa di ulak klol ser makodal mong all the more reason why ang gida di pergi klara vacancies sa patingit ma o mga let ma ay rogul doru la kamasulang itulig el mention sa gida wase we have to practice what we preach. Akunda sa semara rogulat. Especially kung mara ministry rahel, we're very aware of that. Hindi.
Aklam langas arndi bibirarat.
Ngungil lang kuk ulaklat kal kuk ngara. Adra balun may mendirect kal giramel mo. O tabaringi kuk omdas ringi. Kaman musulang arsendi to bring us back on mora COVID all the more reason why get it make sure that the healthy ma immune system rigid am sisi masel po niya kay el maklorak el BS من dia ka mare el garul malu mare el yobo at least ila patingit ma immune system rigid as well talgib so bakle del girel man musulang ra gel ko comments ra of course ngilal direct ngara adra bulul may
no I see
baby that time SLD Osarch Dr. Fraser our health educators sa dimsa del ada mo dia kalsal kura walbol routine mo motrip hindi sila kukal nga ni input tara away gaul mlamo kako dia sa mlamo COVID
at 70 years old
mal dir kom sisi dia kom sugal dia kom high blood akum das malungil example mararata man sulang na kukal share a personal experience ra ma kukora help motivate other lorings
I say and you know Gaafar algorom lor niya COVID min sabet every week kat memit tem ko mga datu emsat akum das wa tol mol momrek tal COVID hindi kat mol sa da gidel issues health issues with Uherbelau. And the more you hear about it, and the more people are going to be educated about prevention and everything else. Lengak omoral was to concentrate on prevention, and it's less expensive and much better than treatment.
I see.
Let's go lang kamangi most cost a lot of money to do that, and it's painful also. But if you prevent it before it comes, I think we all be winners.
I see.
Yeah. Mang kadmo tiamo breke Gaafar sel grupo ngania temiu kom golim bergo ase kan tiako topora okay topora do south any topic
itir kal toktang ngatiam kum das kada mobreka pandemic kada kuk sikole la tele del mora ekel sande el momsada gagid kum das mal muklog tutele leungil information mara adra balum
sera kulu ay sergal was sel misila ala merak lugog must be at call in live and live and severe ngara people all over the world will call in live if they want to so lamang must be moreng sa instead let's say bit time tamula say ngati har adal ko lai kumti mi muru lai el questions se kautet radalong li makase okay I'm going to fix that so I ordered another instrument to do that so people that ask questions we're going to ask them to go ahead and call the number and ask the question themselves.
Mal sulang itulig agi mal look forward and more sa gidel.
Okay.
Or sa MLO spera tegidel vessel equipment mangaral mangal mo. Ngila talk show mo sa bedel entertain live dial in ma questions sa comment sa ramlu.
I see.
And ngani ako ati last ko ati announcement tulig al dilungin.
Yeah, bong din nga yata.
Okay. So mlaring isagid el first release el tilo dara el sales el ko radio makatak sel cost dara testing ra COVID umdas la gam no telgib ngania ra reng ra adra bulul gidela kuk ay tilo dara couple of days ago regarding ra cost testing lakal with a sel amount of $25. Hindi so man makatakli lo sel al time test ra COVID also mga niya adal may gidel test ra COVID mal what lagal bol haraw ngil at hindi ka out of pocket the cost hindi sa gidel $25 ul mga ringi awal gidel dan kura take into consideration ay gel baby ra equipment the low spell mga mokra test mang kadamating ra sa nganya adra bulul kuram lo confused let was gang test kit el donate adra kakarusel bulul may kami ngaram charge so ang amararingi ata kal toba da aududela adra pendingel mo arat test at sumong marman metet hindi ro kut ko ya gire del rulia ko ra cost ringi gire el monia ko ra cost dimet lo se sel la ralingel sel salary ringel adal mo mala specimen ma run ra test ma igel ka ro sel hook equipment to those fail mga tmokot tetet gire ko ra somehow they come up with a cost among ngora timle soman makatagklisay wasing niptong laptop sa sige del gora estimate a cost per test the run the test and the mulmutat at time ngidil adal test adal mel test da bol tobda au dudel mo margi magi melmol mel lodel bangela a healthcare fund el malas melomes lo se magarang ada cover sa gidel basically it's administrative cost HI basing makarabol covers
nga kami sa say hindi mlenga mga daduran mo lo se tiang kulum dasurangel na lo se tiang di agam ne donate lego kami a charge hindi no madangel wasin ya klalo a donation man di free hindi kan nurse malu physician mo bat yan mong geududla gil dudel direct ngania additional cost di mlahal donate magigid lang $25 el cook to me kasi kita malaring while do kora subsidize sel ngal sang set tial masila sumor yang sang sel like parts mga nang klel mal ubeng igel materials that they need to run the machine and they get it from that fund. It's no issue to me. Hindi nga diyan after all kaparit ya health ka, you know. I rather send the $25 mo marana and more a check up then buy a red mint for $25 or $30.
Yeah.
You see what I'm saying?
Mo say tuli ka give him la sama mal clarify min da kal kukul kura wal mangani araw ring rabulung ida da gayid blam dung take into consideration aralawa dengi mga raket mang sige di ako estimate the cost say hindi la sama makatakil say a cost arala test mga rang adi kal gidel limit ra adam di kal belsis bal mera urula sugum sige di number 1 mong gidi the lowai selosing for now suma adam ben test hindi ka do the top dra bok tingin mo harara test hindi niya aral ti toy mangiram work with healthcare fund ma obesity sing aral mechanism adobal mo cover say
okay yeah problem dire kon mo ko understand that imol to la set marur ngil to ya kida ater velo sedo do south ay ko kay to ko mo public educate the public and all ngani monda part of process no mong di mo klaro ngudem pero ko reng sa criticism ngani nga ko sa criticism nga positive criticism it's for us to learn or go out and find out the solution, and it's good criticism. Hindi nga ni tirgel doing it just to have something to say, but not really. They want to know what's going on. They just is so real. Gora di omaka ko mga tokat ko. What you guys doing right now? Como mawala to ko directly ko. Hindi mo maklaro nile. You guys are doing. I tell you, you guys are doing a good job. You guys are doing a good job, especially Dr. Roberts and also. Marogo staff, medical staff ra hospital, mga private sector, yung gamot mahal imolbulu at kita berbuat men muter all time and dir ka COVID-19 free. Makoman masaul sabiul brur teg drurior ignore gel dia how to tell to go le gor mi wem team concentrate tay gel ngania bor lil merkit mapul water pelara tarkep say.
Ya kaman sulang itu lagi.
Okay.
Li wa hindi sa igi di mak sugum di kaya ngodal kere.
Mol masum ko nga pod kay di.
Ang Pablo mal kamang ta traffic mo.
Oh, biaka.
Ilmo mayo del mormi.
Okay.
Dia kaman sulang itulik ko adias broadcasting direct kal T8AA joint broadcast.
Okay.
Kung tete ala urang asulis direct terul toktang na civil may join our panel.
Okay.
Umaklat kalwa sa hotline maldir ka open 488-0555 mansugong mga niya ko rangi tilgeran madakan sa bail raklong ugera ila algususan sa ilmo caller sa hotline Dilbor sa ikit tulig makuk ongeruluriora next week at beta kaptera 7 p.m. and book more next talk show.
Okay, thank you. Bye-bye now. Bye-bye, everybody.
Bye.
Hey, you all. You like my haircut? Josie from Aea, Hawaii. Are you listening? Yeah, you got me sleeping. I was not sleeping. I was reading. But, you know, when I go like this, you know, you think I'm sleeping. Or when I'm meditating, yeah, I close my eyes and I think that's how I meditate. And this is the best place to meditate while people are talking. You see? So don't accuse me that I'm sleeping. I'm working, even though it's 8 o'clock. Yeah, 8 o'clock at night, and I'm still working. And you guys already, my good. Anyway, thank you. We'll see you again next Tuesday. This is Alfonso Diaz saying bye-bye now. I love you all.